This video is about sympatholytic drugs, also known as adrenergic antagonists. Mainly alpha-adrenergic blockers are discussed in this video, while beta blockers will be discussed in next video. Sympatholytics or adrenergic antagonists are a group of drugs that bind to the adrenergic receptors and block the effects of adrenergic agonists at adrenergic receptors, as antagonists have affinity for the receptors but no intrinsic activity. As we know that there are two main types of adrenergic receptors, alpha and beta receptors. So there are two types of adrenergic blocking drugs. Drugs that block the effects of alpha receptors are known as alpha adrenergic blockers, while drugs blocking the effect of beta receptors are beta blockers. Sympatholytics, including the alpha and beta blockers, lowers the blood pressure and heart rate and allow the blood to flow more easily through the blood vessels. Therefore, these drugs are very useful in the treatment of cardiovascular diseases including hypertension, congestive cardiac failure, arrhythmias and angina. These agents may cause reflex tachycardia and salt and water retention. Alpha adrenergic blockers can be classified as non-selective and selective alpha blockers. Non-selective alpha blockers block the effect of both alpha 1 and alpha 2 receptors, while selective alpha blockers block only one specific type of alpha receptors. Non-selective alpha blockers include phenoxybenzamine and phentolamine. You can easily remember the names as the both words end in amine. Selective alpha-1 blockers include pyrazosine, doxazosine, teirazosine, silodosin, tamsulosin and alfuzosin. And these names can also easily remembered as these words end in ocin. Selective alpha-2 blockers include mirtazapine, which is used as an antidepressant, and yohimbine, which is not used clinically. You just have to remember its name for your exam. So we are not going to discuss alpha-2 blockers anymore. Let's discuss non-selective alpha blockers. Non-selective alpha blockers include phenoxybenzamine, which is an irreversible non-competitive inhibitor of alpha receptors, while phentolamine is a reversible competitive inhibitor at both alpha 1 and alpha 2 receptors. Non-selective alpha blockers are used to treat hypertension associated with pheochromocytoma, which is a tumor of adrenal medulla in which excess of epinephrine and norepinephrine are produced. Now listen carefully. In pheochromocytoma, the treatment of choice is surgical resection of the tumor, and during the operation, epinephrine and norepinephrine can be released from the gland and hypertensive episodes can occur. So phenoxybenzamine is used to prevent the hypertensive episodes during the operation. As alpha 1 receptors are associated with vasoconstriction, due to the blockage of alpha 1 receptors, there is vasodilation and fall in blood pressure. As a result, postural hypotension can occur with the use of these drugs, which is a major side effect of alpha 1 blockers. Now alpha 2 receptors. As we know that when alpha 2 receptors are activated, there is decrease in sympathetic discharge. Conversely, when there is blockage of alpha 2 receptors, sympathetic discharge increases, leading to increase in sympathetic tone, heart rate and contractility. Increases leading to tachycardia. Let's talk about an important phenomena called vasomotor reversal of Dale or epinephrine reversal. It says that when non-selective alpha blockers are used before epinephrine, there is a phenomena called vasomotor reversal of tail. Let me explain what exactly it is. As we know from our previous knowledge of sympathomimetics that epinephrine acts on all adrenergic receptors. When epinephrine is given, it acts on alpha 1 receptors, and due to the vasoconstriction there is initial rise in blood pressure, and then there is beta 2 activation with epinephrine and vasodilation occurs. So the blood pressure falls down. But if alpha 1 receptors are blocked before the injection of epinephrine with alpha 1 receptor blockers, then only fall in blood pressure occur with the use of epinephrine and no initial rise in blood pressure occur. This is called epinephrine reversal. Let me discuss the uses of phentolamine. As I have discussed in sympathomimetics video that the use of tyramine is contraindicated in patients taking monoamine oxidase enzyme inhibitors as there are chances of hypertensive crisis. But what if hypertensive crisis occur with the use of this combination? We can use phentolamine to treat such hypertensive crisis. Also, phentolamine can be used to treat hypertensive crisis due to the abrupt withdrawal of clonidine. Phentolamine is also used locally to prevent dermal necrosis due to the extravasation of norepinephrine. Alpha 1 selective blockers. Prazosin, tirazosin and doxazosin are alpha 1 selective blockers, so vasodilation occurs with the use of these agents leading to decreased total peripheral vascular resistance. So these agents are used to treat hypertension. While tamsulosin, alfuzosin and silodosin are also alpha 1 receptor blockers, but they are more selective for alpha 1A subtype, which is found in the bladder neck and prostatic urethra. So the use of these agents cause relaxation of the smooth muscles found in the bladder neck and prostate, leading to the improved urinary flow. That's why these agents are the drug of choice for benign prostatic hyperplasia (BPH). Major adverse effect with the use of alpha 1 blockers is orthostatic hypotension, and this effect is more pronounced with the first dose of the drug, so it is called first dose effect. Other adverse effects include dizziness, nasal congestion, headache and drowsiness. All effects are due to vasodilation. And one more important thing, floppy iris syndrome, in which there is iris which becomes flaccid and it comes near the site of surgery during the intraoperative eye surgery. So that's all about alpha blockers. I hope you enjoyed the video. Hit the like button, subscribe to the channel and share it with your friends, and thanks for watching.